Hey, dude, listen, you're European, Serbian, or whatever. You commented to my video, I guess, about methadone maintenance, and I couldn't really get out what you were saying. I really didn't understand. I'm sorry. I'd like to help, but it looked like you were loaded, you know, heroin loaded, scratching, droopy eyes, the face. I mean, you were fucked up, dude. The whole purpose of methadone maintenance, when they come to you and say, they talk about the methadone program. I don't know how it works in your country, but here they put you on a methadone maintenance to keep you from doing heroin, right? So if you use the right dose of methadone, you're not going to have any withdrawals from any heroin. Now, sometimes in America, the people get fooled. The people are in there getting their methadone treatment just because they can stay, you know, well. They won't get sick if they go every day, and they can not work and still make a bunch of money, and then they try to do heroin over it. And anybody that comes out and tells you that you have to do a bunch of heroin to get over the methadone, it's full of shit. It's all from the same opiate, so it's not. Just the only way, if you're going to use methadone as a detoxification and maintenance program, you only need to use it for 2 weeks at the most. Because, as is with everything else, once the physiological discomfiture, withdrawal, and such is done, it's up to the patient themselves. It's up to you to decide whether you're going to keep using or not. And the ones that put you on methadone maintenance, they want to keep you on methadone after the withdrawals and everything that you don't have. You won't have any heroin withdrawals if you use methadone. They keep you on it because they know that after about a month of using it, there will finally be a true assimilation and a possible addiction. And that's when it's really hard to kick methadone. It takes a while. But that's because of the way it dissolves into fatty acids and such. Anyway, so if you use methadone as a tool, the best way to use it is for about 2 weeks. You use your methadone part to get you. If you want to keep getting loaded, well, then you're just going to keep getting loaded. And the methadone treatment, any other kind of treatment, isn't going to do you any good. Okay? You still have to decide that you've had enough, that you don't want to be in that situation. High all the time, loaded, blah, 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 whatever. So if you're high during your maintenance thing, you just need to be well. You need to be kept well so that you're not going through withdrawals, so that you can function and do things in life. But if you just want to keep getting high, well, fuck. Methadone treatment and any other treatment isn't going to do anything for you. It's just going to give you a cheaper avenue and a cheaper road to the connection. That's what you want. But the only way to really fight heroin addiction and actually do it without all the pain and the withdrawal that why you don't have to make somebody go through that. If you decide that you've had enough and you don't want to be addicted, you'll stop. It's doing that. The physiological withdrawals are not necessary. You use the methadone to get over that for at the most 2 weeks. I'm telling you by experience, you won't have an addiction to methadone. You can stop, you just quit, and say, okay, finally. And then it's up to you after that. You need therapy, maybe, some counseling, maybe, who knows? No, don't go to this higher power shit, go to the 12-step. It is not going to help. It's all about taking what power you have left, what esteem you have left, what self-esteem you have left, and build on it. And help yourself. That's what you have to do. That's the way it works. Well, I answered in a video because I don't have very many fingers. I have no legs. The ones I do have are sore, hard to type. Hope you understood.